Hi, Catherine. We are from Group 7. Our topic is the International Council of Nurses. We are 6 people in group: Patience, Pooja, Ranjung, Jasprit, Sanshung, and Saisha. So, next slide. So, this is the agenda of our topic. We cover 7 questions in that. Next, please. So the first one is the interest of ICN representation comprising members. ICN is the federation of more than 130 national nursing association. It represents the million of nurses worldwide. ICN works directly with this member association on issue of importance to the nursing profession. Members include retired nurse, nursing students, and all nurses. And that ICN founded in 1899, and ICN is the world's first and widest reaching international organization for health professionals. ICN headquarters is situated in Geneva, Switzerland, and ICN also work for the nursing student value contribution to the nursing student level training, and ICN defined as work for undergraduate, postgraduate student, and for graduate student also. Next, please.
Okay, so I'm going to continue from the level of policy of International Council of Nurses. The International Council of Nurses strives to shape healthcare policy globally and regionally, working to achieve universal health coverage by informing policy decisions in areas such as health, social welfare, education, and economics, ultimately promoting the well-being of all individuals. The International Council of Nurses spearheads the advancement of nursing practice and champions exceptional healthcare globally through visionary leadership, strategic partnerships, and the development of authoritative guidelines and position statements, ultimately shaping the future of nursing and healthcare worldwide. Next.
Now I'm going to talk about key policy priorities of ICN. The first one is influencing nursing, health, and social policy on global scale to support the nursing profession, improve healthcare standards, and address socio-economic factors affecting health worldwide. Second one is capacity building with national nurses associations. We call that NNAS, to support national nursing organizations in enhancing the quality of nursing practices and proficiency of nursing professionals within their respective countries. Third one is promoting strong NNAs. ICN actively encourages the development and the strengthening of robust NNAs worldwide. The next one is global representation of nurses and nursing to serve as the international voice of nurses, representing their interest and advocating for their rights and roles. Last one is establishing and managing funds and trust to play a role in the progress of nursing field and support ICN's mission. These priorities align with ICN's commitment for the nursing profession.
Okay, I'm going to talk about the partner ICN policy agenda and the concerning. So ICN works with trust partner and get extra fund to handle different projects beyond our main budget. So those partnerships help us offer many services and that training and support nursing worldwide. So improve their skills and ability in the healthcare. Please next. Please next. So This is her partner for I think we all know those companies, the BD Foundation and the Johnson Foundation support the ICN ODENAS project. Their goals to facilitate the global expansion of the project. So please next. So they focus primarily on the organization development of National Nursing Association. So ICN starts a pilot program in Africa in November 2021. So inviting 23 National Nursing Association to join it. Please next. So it has improved its structure and strength in three main ways. So first one is by using tools and planning to identify needs. Second one is by equipping itself through leadership workshops and training of trainers. So last one is by growing through mentorships programs. So please next.
Okay, according to ICN 2024, it has four values, which are accountability, empowerment, inclusivity, and innovation. So, in accountability, the ICN operates with a strong sense of integrity, meaning it always acts as honesty, fairness, and ethical principles. And the ICN prioritizes openness and transparency, keeping its members fully informed about its activities, decisions, and financial matters. This approach underpins the organization's commitment to long-term sustainability. And in empowerment, the ICN is dedicated to empowering nurses, both individually and collectively, by providing them with the necessary resources, education, and support to enhance their skills and knowledge. This empowerment helps nurses become more effective in their roles and more influential with the healthcare system. And in inclusivity, the ICN embraces a diverse range of perspective and ideas, understanding that the diversity enriches discussion, leads to better solution, and fosters innovation. This inclusive approach help to build a more representative and equitable organization. And in innovation, it uses a new and creative methods to lead the nursing profession, and also it aims to implement sustainable solutions in a world that is constantly changing. So the next, please.
So now I'm going to discuss about the engagement of members and stakeholders. So if I talk about members, then ICN is the federation of more than 130 national nurses association and representing 28 millions of nurses worldwide. So the ICN Congress provide platform for the nurses to deliberate on critical issues and exchange their best practices and contribution to the policy formulation. And it also deliberates on critical issues like facing the nursing profession, for example, like nursing leadership and shaping the future of healthcare, and role of nurses in disaster management and promoting the healthier communities. And Congress also facilitates to exchange the best practices, knowledges among the nurses, and enables them to contribute in policy formulations by participating in discussions. And it also fosters networking and collaboration among national nurses associations and individuals nurses from around the world. Next, please. So in public and media management, they also press release and share updates to raise awareness about the nursing profession, and they share stories, experiences of nurses around the world, and they also promote events, conferences, and educational opportunities, and they facilitate discussions and dialogues on some critical issues. Next, please. So the next is policymaker and government. So they also advocate and highlights the needs and concerns of the nursing workforce and advocating for policies that supports the nursing education, practice, and working conditions. And this offers evidence-based recommendations and best practices and participates in the discussions and attending global health events and conferences. Next, please. And the last one is the legal and judicial activities. So it also protects the nurses through legal protection, because nurses always involved in legal activities for patients during nursing practices and nursing care and for the human rights.
Okay, according to the 3I framework, I'm going to discuss about the idea, interest, and institution of ICN. So idea means the beliefs, values, and knowledge that shape policy and influence decision making. So for ICN, the ICN is a group made up of over 130 different national nursing organizations. Together, they represent 28 million nurses from all over the world. And also the ICN speaks for nurses everywhere, making sure their concerns and ideas are heard by important decision makers around the world. And it promotes policies that ensure safe staffing levels, patient safety, and equitable health care. And it ensures that the patients are kept safe and everyone has fair access to health care. And the ICN works with big organizations like WHO, UNs, and other NGOs to help shape health policies and around the world. So ICN provides resources for ongoing education and training for the nurses. Like it offers tools and programs to help nurses keep learning and improving their skills throughout their careers. And also it supports leadership development and career advancement in nursing through training and mentorship opportunities. Okay, and the next one is example of interest. In the interest means the goals and priorities of different groups or stakeholders that influence policy outcomes. So ICN advocate for safe staffing levels, ensures manageable workloads and better patient care. So ICN work to make sure there are enough nurses so that their workloads are reasonable and patients get best care possible. And also it improves nurses' financial stability and job satisfaction by ensuring that the nurses are earning better pay and feel more satisfied and happy with their jobs. And it also provides supportive and safe environment to the nurses. And it also helps. It also promotes the evidence-based practices, and it also contributes to the sustainable development goals. It help to achieve global goals that aim to improve health, reduce inequality, and promote well-being around the world. And the example of institutions, the institution means the formal and informal rules, norms, and structures that govern policy process and decision making. So in institution, the ICN collaborates with major international health organizations, like as we already discussed it, collaborates with World Health Organization, UNs, and NGOs, and it engages in partnership with academic institutions, research bodies, and healthcare organizations. And it also develop and promote standards, guidelines, and ethical codes for nursing practice. And the ICN hosts global events where nurses can learn, share ideas, and discuss important topics in healthcare. Yeah. So these are the references for our PowerPoint presentation, and it's the end of our presentation. Thank you so much.